Anal cancer, what you should know. Hello. The anus is located next to the rectum, which is the last part of the gastrointestinal system. Anal cancer occurs when cells in the anal canal mutate and grow out of control, forming tumors. Signs and symptoms of anal cancer. Recognizing the signs and symptoms of anal cancer is important for early intervention. Although early-stage anal cancer symptoms are often unclear and nonspecific, however, if the following signs and symptoms occur to you, you should urgently see a doctor because although it could be a sign of many other diseases, but it could also be a sign of anal cancer. 1. Anal bleeding. Unexplained bleeding from the anus is one of the main symptoms of anal cancer. Blood may be visible in the stool or on toilet paper after a bowel movement. 2. Anal pain or discomfort. Persistent, prolonged pain or discomfort in the anal area, including itching or a feeling of tightness, may be a sign of anal cancer. 3. Change in bowel habits. Changes related to bowel movements such as diarrhea or persistent constipation. And of course that also changes the pace of defecation as well as the inconvenience and discomfort that arises from each defecation. 4. Feeling of a lump or mass. The feeling of a lump or mass near the anus or in the anal canal often occurs in people with anal cancer. There may even be swelling and pain in this area. 5. Itching or anal discharge. Persistent itching, pain or discharge around the anus can also be a sign of anal cancer. And 6. Unexplained weight loss. Like many other forms of cancer, anal cancer can lead to unexplained weight loss, fatigue, and general weakness. So, what causes can anal cancer have? The exact cause of anal cancer is not fully understood. However, studies also show that some risk factors may increase the likelihood of developing this type of cancer. These risk factors include 1. Infection with a virus called human papillomavirus, HPV. Infection with certain strains of HPV, especially HPV-16 and HPV-18, is a significant risk factor for anal cancer. This virus is commonly transmitted through sexual contact. 2. Smoking. Smoking, including passive cigarette smoke, increases the risk of developing anal cancer. 3. Weakened immune system. People with weakened immune systems, such as those with HIV/AIDS or on immunosuppressive therapy, are at higher risk. 4. Older age. In fact, it is noted that the age at which most patients are diagnosed with anal cancer is between 50 to 80. And 5. Frequent damage to the anus. Anal fistula, frequent discharge of fluid and stool, causing irritation to the tissue around the anal opening. In addition, forms of anal damage that cause swelling, redness, and prolonged pain increase the risk of developing anal cancer. How is anal cancer diagnosed? Diagnosis of anal cancer usually involves a combination of medical history, physical examination, and diagnostic tests, which may include 1. Digital rectal examination, DRE. A digital rectal examination, DRE, is a test that examines a person's lower rectum, pelvis, and lower abdomen. This can detect any abnormalities or tumors in the anal canal or rectum along with other health problems. 2. Biopsy. A biopsy involves removing a small sample of tissue from the affected area for laboratory analysis to determine whether cancer cells are present. 3. Imaging tests. Imaging tests such as an MRI, CT scan, or PET scan may be used to determine the extent of the cancer, staging, and identify any metastases to other organs, other parts of the body. How is anal cancer treated? Treatment for anal cancer depends on the stage of the cancer, overall health, and individual patient decisions. Treatment options may include 1. Surgery. Surgical removal of cancerous tissue, local excision, can be performed for small, localized tumors. In more severe cases, procedures such as abdominoperineal resection, APR, may be necessary to remove the anus, rectum, and surrounding tissues. In this case, the patient will have to wear a colostomy bag. 2. Radiation therapy. Radiation therapy uses high-energy beams to kill cancer cells and can be used alone or in combination with surgery. 3. Chemotherapy. Chemotherapy involves using powerful drugs to kill cancer cells or stop them from growing and dividing. It can be used before surgery, neoadjuvant chemotherapy, or after surgery, adjuvant chemotherapy, or in combination with radiotherapy. 4. Targeted therapy. Targeted therapy drugs can be used to specifically target and block certain pathways involved in the growth and spread of cancer cells. So, what can we do to prevent anal cancer? Although not all cases of anal cancer are preventable, there are some measures that each of us can and should take to reduce our risk. 1. Practice safe sex. Apply safety measures such as using condoms when having sex, especially anal sex, to reduce the risk of transmitting HPV virus. 2. Vaccination. The HPV vaccine is highly effective in preventing infection with the most common cancer-causing HPV strains. 3. Quit smoking. Quitting smoking and staying away from secondhand smoke can reduce the risk of developing anal cancer and other smoking-related diseases. And 4. Regular examinations, regular screenings. People at higher risk of anal cancer, such as those with HIV/AIDS or a history of anal dysplasia, should have screenings done. Filter regularly to detect and treat promptly if anal cancer occurs. In summary, as with many other types of cancer, early detection and timely treatment are critical to improving treatment outcomes in people with anal cancer. Recognizing the signs and symptoms, understanding risk factors, and taking preventative measures can help reduce the burden of this disease and improve overall health. If you experience any symptoms suggestive of anal cancer, you should see your doctor as soon as possible for timely and appropriate examination, diagnosis and treatment as well as management of the condition. Wish you health. Thank you, goodbye and see you again.